Imagine one of those blazing summer days, high temperatures, heat waves rolling in, and everyone scrambling to stay cool. But for some folks, especially elderly living alone or those with chronic health conditions like cardiovascular, respiratory issues, or diabetes, summer heat isn't just uncomfortable, it can be downright dangerous. Our bodies have sophisticated ways to handle the heat. Thermoregulatory responses like sweating and blood vessel dilation, but these mechanisms can falter, especially when combined with socioeconomic factors that limit access to cooling or healthcare. And if you're taking medications like psychotropics, antipsychotics, hypnotics, or drugs for psychosis and dementia, your body's ability to cope with heat stress might be even more compromised. Heat stress can lead to elevated body temperatures and, in extreme cases, hyperprexia or heat stroke, which can trigger serious conditions like neuroleptic melanite syndromes. Certain brain structures like the cerebellar peduncles, dentate nuclei, and Purkinje cells are sensitive to heat injuries, sometimes showing radiologic cerebellar atrophy or white matter changes in fovea and hilum regions. These injuries can cause cerebellar syndromes, including palatomyoclonus, those rhythmic movements of the palate, and affect pathways like the thalamic tract, disrupting coordination and movement. Now, heat doesn't just affect the body, it stirs up a neuroinflammatory storm. When the brain faces heat shock, proteins like heat shock protein 70 are expressed, and glial cells such as Bergman glials respond. This cascade can lead to microglia activation, astrocyte reactivity, and the release of cytokines and other extracellular signaling molecules, all disrupting brain tissue homeostasis. The result: increased oxidative stress, neuroinflammation, and even damage to the blood-brain barrier, which can contribute to cognitive impairment and to brain conditions like dementia and other neurodegenerative diseases. In fact, the effects of extreme heat and wildfire smoke exposure are not limited to the lungs. They can lead to cerebrovascular issues, worsen neuroinflammatory response, and impair cognition. Poor sleep quality, often heightened during heat waves, further hampers the lymphatic system's ability to clear waste from the brain, increasing the risk of neurodegenerative processes. Mental health disorders, including synucleinopathies, epilepsy, and mood disorder, can also be affected by heat stress, which might cause disinhibition, impulsivity, or even hallucinations, especially those on certain medications like dopamine or noradrenaline reuptake inhibitors, or SSRIs that influence neurotransmitter levels. So, as climate change fuels more frequent and intense heat waves, wildfires, and smoke exposure, understanding how extreme heat influences human brain health become crucial. Protecting vulnerable populations, ensuring access to cooling and health care, and recognizing the neurological signs of heat-related stress can help keep our minds sharp and our brains safe even when the weather is sizzling.